Hey, Dr. Frank Simoncini, Southeast Valley Urology, Gilbert, Arizona, the FloFxr. Come and see me at Southeast Valley Urology. Smash the like button, it helps us with the algorithm. We're talking about incontinence today mainly, so we're going to talk about a specific type of incontinence in men right now. So, one of the more devastating, or in my opinion, devastating potential complications of radical prostate cancer surgery is leakage of urine. It's called post-prostatectomy incontinence, or you can even call it stress urinary incontinence type 3. It's sphincteric incontinence. And what that means is that sphincter may not close enough so you can control your urination, like when you're doing activity, lifting heavy, sometimes you're going to leak. Some people, a little bit, like a drop here or there, that's reasonably acceptable. If it's a lot, though, then it becomes a problem, in my opinion, a quality of life issue. What we can do about it, there is one procedure, in my opinion, that's an absolute game changer. It's a quality of life changer. And for patients out there in that situation, it's a game changer. It's a life changer. It's called an artificial urinary sphincter. So it sounds invasive, which it is a little bit, but it works superbly. So we put a cuff around the urethra, and this cuff holds the urethra completely closed. So pretty much whatever your body's not able to do, this will hold it closed. There's a small pump down in the scrotum. When you want to urinate, you squeeze the pump, it opens up the pump, you urinate normally, and then it resets itself in about 30 seconds. Absolute game changer. Gets you from multiple pads a day to sometimes nothing, sometimes just maybe a small liner if you get caught off guard. Game changer, life changer, quality of life changer. Come and see me at Southeast Valley Urology. Dr. Frank Simoncini, I'm the FloFxr.